Hello friends, I am Rajendra Bhalla from One Cure for All Diseases. I am talking about today about coronavirus. Yesterday also I made one video, but I missed one point. One is that I have been experimenting and came to a conclusion that saliva can be increased by regulating the fluid intake. Regulation usually means drinking water with the meals and reducing the fluid intake. Now, coronavirus is said to cause dry mouth and thirst. Advisory has been given for preventing spreading of the coronavirus that one should be drinking water frequently, and this is to avoid dry mouth symptoms. The person should not be feeling dry mouth. Now I have spent last 3 years in experimenting with what causes the dry mouth, and accordingly I had made a video as well, and I have been promoting that video like anything, because this is very helpful for the humanity and for health of everybody. I am giving the link of that video in the description of this video. Please click the down button and see the description, and in the description click on the video link, and you will be surprised that more and more fluids that you will take, whether in the form of fruit juices, milk, tea or anything, if the fluid intake is excessive, there will be dry mouth. And dry mouth symptoms are also there in lot of other health conditions. You can Google all of these as, let us say, dry mouth and diabetes, dry mouth and BP, dry mouth and heart disease and stroke. Now I have listed out some of the other medical conditions which have been accepted to cause dry mouth, and these are diabetes, blood pressure. In the blood pressure, dry mouth is said to be caused due to the medicines which are given to the patient of high blood pressure. The first line of defense, first line of treatment of high blood pressure is diuretics, which cause increase in the urine output. So that is supposed to cause this thing. So that means it's not good. Anyway, coming down, it is heart disease which causes dry syndrome, dry mouth thing. And you must have heard that in case a person is about to die and is in a critical stage, then one should pour Ganga Jal in his mouth. So that also indicates that it is a common phenomena with the critically ill people, that their mouth is extremely dry. Now the next condition is stroke, and one of the very important thing to be noted is diabetes, BP, heart conditions and stroke, and even rest of them as well. These are caused due to kidney disease or failure, and kidney disease or failure can be defined not in the form of that where once you need the dialysis. Whenever there is a kidney disease, the body is not able to expel the unnecessary or the excess amount of fluids which we are ingesting, which we are drinking. So that is slowing down the kidneys. The kidney is not able to expel the entire thing, and that causes these diseases. So the medical science, medical community, whether you kind of blame WHO for that, or pharmaceutical industries or health ministries of the countries, this industry, these diseases are there for the last hundreds of years. They have not been able to address any of these. As you are aware, day by day diabetes, BP, heart disease and stroke are increasing, and the cancer rates are just going through the sky. Now for the last 3 years I have been very active on Quora. My answers are viewed almost 2 lakh plus times in a month. I am now doing these YouTube videos also for the last maybe 1.5 years. In spite of cautioning, and I am also on LinkedIn, and in spite of cautioning thousands of researchers, I made a group also for carrying out for basically validating my finding that dry mouth is caused due to excess fluid intake, and that's it. Now I will again list out. Diabetes is caused because of dry mouth. BP is cause, heart disease cause, stroke, autoimmune disease like eczema, Alzheimer's, Raynaud's syndrome, HIV, AIDS, and fever. Even in the normal fever, which is also one of the conditions of coronavirus also. And this chemo and radiation therapy of cancer also causes dry mouth. Tooth decay. If you are there is sensitivity in the teeth while drinking cold or hot water or eating things, the immediate response should be to reduce the fluid intake. The moment you reduce the fluid intake, immediately the next 1 or 2 days you will find that saliva is gone up, and this saliva is basically meant to dislodge the particles of food which are getting stuck in the mouth, and they are drained out to stomach and cleaned out from the body. Now at the age of 57, I am heading towards 58 years this year, and I have no BP, I have no blood sugar, I have no heart disease discomfort, my all other conditions are not there. I have all full teeth without any kind of sensitivity, without any loss of any kind of problem with my teeth. I have no issues with my kidney as well. Now my saliva, there's a lot of saliva in the mouth, and I have no issues at all of any health sort. And the only condition which I had about 3 years back was trigger finger. See, this finger, this triggers, it gets stuck here. Now last year when I started, I was having this same trigger finger with this middle finger, and this was so painful that there was pain throughout my this arm, and moreover this when I used to get up in the morning, this used to get stuck like this, and I had to use the other hand to open it, and it was very painful thing. And that is when I started drinking water with the meals and reduced my water intake, and my saliva production increased within maybe 3-4 days or 5 days. And that could be due to my habit of not drinking any water with the meals for the last 15 years. Now this finger is fine. Now subsequently I had developed this finger, there is no pain, and this happens sometimes. Now after doing it 2-3 times, my trigger thing is improved. Now if you take care of your saliva and your tongue also, the tongue should be pinkish, it should not be red. At the same time, there should not be any white layer on it also. That is an indication of maintaining the best kind of kidney and liver. And if the kidney and liver are functioning perfectly, no coronavirus can cause any trouble to you. So be prepared against the coronavirus. And you can also look at my Quora answers and the upvotes, and you can see how many people have been cured by me of eczema, how many people are upvoting on a monthly basis my eczema answers, and how I have got recognition for BP and diabetes and a lot of other acidity also. And dry mouth is also a condition of acidity. When we are hit by kidney disease, then water intake is reduced, but not when these symptoms of kidney disease appear. All these indicate the kidney is being impacted. It may not have fully failed. That is the time when we should take care of managing our fluid intake. Keep watching my videos, and you'll find some path-breaking things which you will not find anywhere else in the world. Thanks for watching video.